holiday. Today we're joined by Kelley Gebhardt with Happy Tales Veterinary Emergency Clinic to talk about pet safety during the holidays. So this next holiday that's coming up is Thanksgiving, food-related holiday. So what types of things are you saying absolutely not, do not do that with your pet?
Obviously the toxic things like grapes, raisins, onions, garlic, stay away from those. And a lot of the foods we cook have a lot of onions and garlic, so be mindful of what the ingredients are. But also stay away from the fatty foods, the high fat, creamy foods like gravy, buttery things, creamy things, anything that's high fat and sugar, stay away from those.
Okay, so many of us are going to cook that turkey, we're going to be deboning it, we're going to be doing all that stuff and whatever else, and we're going to be like, throw the dog a bone. That's like the oldest saying in the book. Right. Are we allowed to throw the dog a bone?
Do not do it. It is one of the worst things that we see over the holidays because say your dog gets into a chicken or a turkey carcass, right? And they eat the whole carcass, then their stomach is full of bones. Fortunately, most time cooked chicken and turkey bones will digest on their own over time, but we have to bulk up their food to protect the sharp and pointy bits of the bones. But you also have pork bones and beef bones and rib bones, and these things can cause terrible problems. They can break teeth, cause lacerations in the mouth, get stuck in the esophagus, cause esophageal lacerations, intestinal foreign bodies, intestinal lacerations, and be a very expensive medical or surgical situation to treat. So in general, no bones at all.
Which is the last thing you want on a holiday is taking your animal to the emergency vet clinic if you can avoid it. Are there other things for like this holiday and also like maybe the Christmas holiday that we should be aware of when it comes with our pets?
Right, so one of the biggest things we see is medication toxicities and making sure have guests coming in the house and maybe their purse is on the floor. Maybe grandma has taken some medication in the bathroom and dropped a pill. Make sure that your guests have all their medication safely secured and also know the number of pills that they have in case something gets dropped. Also get a list of medications. If maybe grandma comes and has some medications and your dog is sick, get a list of medications from grandma so you can bring it with you to the emergency clinic. So if we can match the symptoms with a medication, it helps us treat your pet better. But that's one of the things a lot of people don't think about over the holidays, that we see a lot of toxicities from medications that get dropped, or pets get into the purse that's on the floor and get into the sugar-free gum or the medications and things like that.
Yeah, and sugar-free gum, sugar-free mints, that kind of stuff, that's really bad for the animals.
It can cause low blood sugar and liver failure. So any of those sugar-free products with xylitol, toothpaste, mouthwash, gum, muffins, anything like that, keep them out of reach.
Okay, we've been talking about all the things that you're not allowed to give your dog. How about the stuff that you can give your dog? What stuff from the Thanksgiving table can we actually give the dog?
Oh, so many good things. Like lean meats is good, fresh fruits and veggies, so carrots, cucumbers, broccoli, cauliflower, melon is good, sweet potatoes without butter and salt, all the good stuff. You can do cooked sweet potatoes, cooked potatoes, but focusing on the healthy things, the lean meats, those things are good. And portion control is really important.
And portion control. So, and that's what I think. I think, okay, I'm going to give Kona a little bit of Thanksgiving dinner. So does that mean that I give her regular kibble and then also put the stuff on top? Or do I minimize the kibble when I'm going to give her the other stuff?
If it's fresh fruits and veggies, you can just put it on top. If you do a little bit of lean meats, you can just put it on top. But the thing about treats for dogs is they don't need a whole piece of turkey. They have a little piece and they're like, I just scored a very tasty treat. One little piece of carrot and they're happy with that. And you can give them multiple small pieces to continue to feed that, fulfillment for them without giving them a whole entire piece of steak or something.
Okay. All right. When it comes to seeing a doctor, right, when it's an emergency and stuff like that, how do you know when you need to go and see someone?
I'm so glad you asked that question because we are there for anything you need, right? We're there for sick and injured. It's not always major trauma. Like we see a lot of hit by cars and major traumas like that, heart failure and critical issues. But anytime you think your pet is not acting right, you're the one that knows the best about your pet. And if you think that they're off, you can never be too aggressive to get them checked out because you might catch something very early in the stage of an illness or injury that we can treat more quickly or get earlier in the process and have a better outcome. So a lot of times the subtle changes indicate an underlying problem, and we never want anyone to underestimate their internal feelings and instincts about their pet. So vomiting, diarrhea, toxicities, anything like that, anything you're worried about.
All right, so I would think that a lot of people would say, I don't need insurance for my pet, and because I'm just going to pay out of pocket, I'm sure the insurance is not going to cover all the things that I needed to cover. And you say what to that?
I think insurance is one of the most valuable things you can do for your pet because it is there for in times of need, of illness and injury. There are plans out there that are designed for preventative care, but the premiums will be higher, your deductibles will be different. They're just designed differently. The ones you want to focus on are ones for illness and injury because it will allow you to provide the care for your pet that you want to provide without the financial burden. I personally have pet insurance on all of my dogs, and
what do you use? Because people will ask.
There's so many plans out there. I personally use Trupanion, and I really like Trupanion. We have a $250 deductible, and then after that, they pay 90% of the bill. So it really financially changes the picture for the kind of medical care you can provide and surgical care for your pets in times of need, whether they're ill or injured. And that's really the key point of insurance. If you come to an emergency clinic and you know, okay, my bill is going to be dropped by $4,000, it's an enormous change in what you can provide.
Right.